My name is Etukudoh. I'm a student of Brandman University. I'm presenting on proactive health communication campaigns titled Reducing Relapse Among Maricopa County Patients with Schizophrenia. Identification of at-risk population and subpopulation. The Healthy People 2020 for mental health and mental disorder is to improve mental health through prevention and by ensuring access to appropriate quality mental health service. What are Healthy People 2020 indicators? The Healthy People 2020 identify health-related quality of life and well-being as indicators of population health for the next decade. The indicators will be used to assess the health of the nation, to facilitate collaboration across sectors, and motivate actions at the national, state, and community levels in order to improve the health of the U.S. population. The at-risk population of relapse include Maricopa County residents with suicidal ideation, depression, bipolar disorder, anxiety disorder, mood disorder, borderline personality, and schizophrenia. Subpopulation include total population of Maricopa County with schizophrenia. The majority, which is about 52.3% of the state's SMI population, were enrolled within the other geographic service areas across the state, while the remaining 47.7% were enrolled in Maricopa County alone in 2015. Members with SMI were predominantly female, 55.5% schizophrenia patients. What does patient think about relapse? Maintaining sobriety is often an everyday struggle. The potential for relapse is always there. Knowing the warning signs that would indicate relapse can help to avoid it. What does the provider think about relapse? Is to know what to look for as a potential trigger for relapse. Is to know that relapse can be especially dangerous for someone who has abstained from drug use for a long time. Once relapse occurs, it can be difficult for an individual to get back on the road to recovery. Prevalency in the world, America and Maricopa County. About 1% of the population are diagnosed with schizophrenia. Approximately 1.2% of Americans, which is about 3.2 million, have the disorder. About 1.5 million people are diagnosed with schizophrenia annually. In the United States, this means about 100,000 people will be diagnosed, which translates to 7.2 people per 1,000, or about 21 people within a city of 3 million who are likely to be suffering from schizophrenia. Schizophrenia is one of the top 15 leading causes of disability worldwide. Estimated prevalence of severe mental illness in Arizona total about adult population of 5.4 million. Individuals with schizophrenia are about 59,000, and individuals with severe bipolar disorder are about 118,000. So, brief overview of relapse among patients with mental illness. Relapse among patients with mental illness. Relapse is both a clinical problem, is also an economic issue these days in the current care of patients with mental illness. It is the return of worsening symptoms that require hospitalization. People with depression, bipolar disorder, and schizophrenia have a short life expectancy in Maricopa County and America. They die on average 10 to 20 years sooner than the general population. About 43.8 million adults experience mental illness in America annually. Psychoeducation and medication compliance has been shown to help decrease relapse in these patients. It helps patients to be medication compliant in order to reduce relapse. Relapse is a threat that needs to be reduced among these patients, since health belief model is about threat reduction. By educating patients more about their illness, there will be a decrease in relapse symptoms. This is health communication theory, approach, or concepts. meaning conceptualizing the entire theory. Patient-modifying variables include age, gender, personality, social economic status, and knowledge may contribute to intermittent or recurrent relapse. Perceived seriousness in relapse reduction, perceived susceptibility to relapse reduction leads to perceived benefit versus perceived barrier to medication non-compliance. Perceived threat of relapse will then lead to self-efficacy about schizophrenia. Cues to action will encourage medication compliance, and then the likelihood of engaging in health promotion behavior. Health belief model continues. The health belief model explains and predicts the likelihood of taking action based on perceived threat. In this case, the perceived threat is relapse. Studies shows that hospitalization occurs secondary to relapse. Effective action, according to current studies, shows that medication compliance does help reduce relapse. Provision of specific cues to action in order to activate readiness to change. Educating clients during psychoeducation groups will expose the benefits of medication compliance. Many patients relapse soon after treatment reduction and discontinuation. Transition from remission to relapse may be abrupt and with few or no warning signs. The perceived seriousness of worsening of symptoms of this condition could result from barriers such as non-medication compliance and attending psychoeducation schedule groups. The perception of susceptibility to the condition needs to be addressed during psychoeducation group. Adherence and other factors predisposing to relapse should be a major focus of attention in managing schizophrenia. Encouraging self-efficacy as evidenced by reduced relapse by providing referrals to screening, psychotherapy or psychoeducation, medication compliance class, and suicide prevention information. Okay, I put the health crisis there. This is a health crisis and health issue. The health risk, having a diagnosis of mental illness, lack of education, suicidal ideation, and medication non-compliance. And then health crisis, relapse may be preventable before it becomes a crisis situation that will require many mandatory treatment. If there is a clear and convincing evidence that a proposed patient as a result of mental disorder is a danger to self, danger to others, persistent or acutely disabled or gravely disabled and in need of treatment, and is either unwilling or unable to accept voluntary treatment. What is the health issue? What is happening and why is this campaign important? Increased mortality rate occurring medical conditions such as heart disease, liver disease, and diabetic contribute to the higher premature mortality rates among individuals with schizophrenia. The possible reasons of this excess early mortality and increased rate of this medication condition and under detection and under treatment of them, and then that rate is far greater than the general population, with the highest risk in the early stages of illness. Approximately half of individuals with schizophrenia have co-occurring mental and or behavioral health disorders. Financial costs associated with schizophrenia are disproportionately high relative to other chronic mental and physical health conditions. This reflects both direct costs of health care as well as indirect costs of lost productivity, criminal justice involvement, social service needs, and other factors beyond health care. Overview of proposed health promotion and health communication. I will be using social media, Facebook, Twitter, and Instagram to post information about relapse reduction among adults, patients with schizophrenia in Maricopa County. I will create reminders group on Facebook or make bronchos for practitioners to promote screening patients, suicide prevention, medication compliance, and psychoeducation. I will advocate for relapse-free day in Maricopa County via legislative hearing or lobby. The link of this group will be appearing in news feeds or blogs of Southwest Behavioral and Health Services site because they are mostly visited by patients. since they have a majority of the insurance depicted or shown there. And also the Arizona State Department of Health Services will be showing those also based on permission. Health promotion and health communication, again, that's screening patient using the use of a psychoeducation on the bronchial. It will encourage, the bronchial will encourage psychiatrists to screen the patients when they come in for their treatment and detect schizophrenia, and then refer them to psychoeducation. And I posted all the available psychoeducation groups here that I could find. That's an example of the family psychoeducation evidence-based practice for these kinds of patients. And also my other health promotion will be the use of bronchial for practitioners' office to be able to teach patients personal medication compliance, and also suicide prevention, all the hotlines that they need to call if they have gone too way far in relapse and then they are already having extreme suicidal ideation. They need help, so they can call any of these numbers for support. This will also be presented in pamphlet form in the doctor's office, pasted everywhere. I can put it in the grocery stores in town, and also in schools, display for them to see. I have my reference there. Please, if you have any questions, thank you very much.